will be presenting on benefit versus burden, how telehealth utilization affects vulnerable populations. And this is my contact info if anyone would like to reach out later. I'll also have it on a slide later in my presentation. So our learning objectives for today's presentation, we will define and provide evidence of health disparities in telehealth. We will discuss telehealth utilization and inequality experiences for vulnerable populations. We will describe efforts to reduce health disparities in telehealth. We will discuss how telehealth can bridge health equity gaps and expand access to care. And we will also explore opportunities to expand health equity and access for vulnerable populations. So we will get started speaking about health disparities in telehealth. Disparities in health equity and healthcare access across minority, racial, and ethnic groups, those with lower incomes, lower socioeconomic status, older adults, and those who live in rural areas are well documented in health statistics and research data. This country's challenge with health disparities is the result of resources being unevenly distributed across communities. In order to address health disparities in health outcomes across disadvantaged and underserved populations, we must effectively analyze how access to care can be improved through the use of telehealth. We can improve access to quality and affordable healthcare by increasing adoption of telehealth, especially among those who have been left out or left behind. This is a great illustration that shows the difference between health equity and equality. As you can see in the equality image, each individual has been given a box to stand on to see over the fence. Equality means that the tools and assistance are evenly distributed amongst individuals. However, the tools and assistance are not necessarily catered to their personal needs. The equity image shows that each individual received one or more boxes based on their need to see over the fence. Equity means that individuals are given personalized tools that identify and address their inequality. The graph here shows the telehealth utilization in Louisiana and nationally during the height of the COVID-19 pandemic. Pre-pandemic, telehealth accounted for only 1% of CMS claims, both nationally and in Louisiana. Telehealth has been available for many decades. Prior to the COVID-19 pandemic, telehealth was offered in limited circumstances to address specific clinical issues. This was due to restrictions on telehealth reimbursement and state-level policies that limited the utilization of telehealth. There continues to be a significant amount of discussion regarding legislation, regulatory changes, and funding allocation towards telehealth on a national and state level. COVID-19 has increased federal attention on telehealth and rural health. The overall assessment is that telehealth has great potential to reduce problems of access to care for disadvantaged and underserved groups. Sustained adoption is likely to persist as providers increasingly leverage telehealth capabilities as a means to not only survive, but to competitively thrive. Higher rates of telehealth usage are now standard in many practices since the COVID-19 pandemic. Unfortunately, those who would likely benefit the most from telehealth are also the ones with the greatest obstacles in using it. Extensive research has documented disparities in health outcomes across minority groups, those with lower incomes and socioeconomic status, older adults, and those who live in rural areas. While telehealth can enhance the future of healthcare delivery for certain conditions, dramatic disparities in access, quality, and patient experiences cannot be overlooked. To make significant progress in reducing gaps in access to care, technology, and digital literacy, we must be better diffused across socioeconomic and demographic groups. With higher rates of telehealth implementation, we must also focus on emphasizing patient satisfaction, providing efficient and quality care, and minimizing costs. As we create policies and expand the use of telehealth services, advancing health equity must be prioritized. Telehealth remains an essential part of the current healthcare landscape, but it requires policy changes to ensure the healthcare community benefits without widening disparities in care. It is our shared responsibility to ensure equal access to quality telehealth care for everyone. We can do that through improvements to telehealth workflow, staff training, community resources to meet the needs of underserved populations in our communities. Providing health equity in telehealth means making changes in policy, digital literacy, and technology. This will help telehealth providers reach the most vulnerable communities that need these services the most. Improving quality means improving outcomes, but the measures needed to improve quality can be quite complex. Specifically, measures are needed that address the digital landscape of our country, timeliness of care, telehealth utilization by individuals who are not digitally literate, adaptability and health system readiness, health equity, and much more. As a collective, we must identify which measures will be most effective. Encourage the development of new measures that address the gaps in health equity, and promote the use of measures to impact equity in telehealth utilization. Virtual visits are growing in popularity. Though in-person office visits may be necessary in certain cases, there are many benefits to telehealth visits. As telemedicine has become widespread, professionals and patients have grown more comfortable with connecting virtually. Connecting with doctors online is a great way for patients to get the healthcare they need from the comfort of their home. Telehealth provides access to resources and care for patients in rural areas with provider shortages. It decreases costs, it reduces patient travel and wait times, and allows for comparable or improved quality of care. In addition, telehealth helps to address physician burnout by reducing clinicians' drive time and allowing them to have more time to see more patients. Telehealth cuts down on no-shows and can improve the efficiency of a practice. It can also provide a competitive advantage, attracting and retaining more patients with new models of care. Telehealth is a feature of some of the best performing practices in our nation. While there are several benefits to telehealth's ability to enhance care delivery, increase access to care, and achieve positive health outcomes, we must also remain mindful of the risks and barriers of telehealth technology. Telehealth will continue to redefine healthcare for years to come. It's important that we embrace the benefits of this convenient, efficient, and effective delivery model. Although patients and providers enjoy the benefits of telehealth, the widespread adoption of telehealth has unfortunately been hampered by a variety of barriers. Some vulnerable populations could not take advantage of innovations in healthcare. Therefore, their opportunities were limited. Disparities such as access to broadband can limit an individual's access to telehealth services. And this issue was evident prior to the COVID-19 pandemic, but the increasing reliance of these services during the pandemic has widened health disparities. While urban areas have access to the latest technology, some rural and underserved patient populations may see a widening inequality in access to healthcare via telehealth platforms. We have also seen how telehealth implementation is hindered by regulatory, legal, and reimbursement barriers. Providers sometimes struggle to maintain compliance with state and federal legal requirements while using best practice guidelines to provide patient safety. It will be up to policymakers, payers, and providers to determine if the changes made to telehealth policy during the pandemic outweigh the concerns. Will these telehealth flexibilities remain permanently after the public health emergency? Does telehealth enable accessible, quality healthcare? These are questions and concerns that are constantly being considered. Despite these barriers, telehealth acceptance will likely continue to increase as patients and providers become more adapted and comfortable with the technology. Telehealth is an efficient and effective tool for improving healthcare access and outcomes, Yet several barriers to telehealth practice remain an obstacle. Telehealth is so beneficial, but we must also identify and understand and address the health disparities. Throughout this presentation, we will discuss in more depth how vulnerable populations are directly affected by telehealth implementation and how we can address this issue together. I will now transition to a concept board, and it will require some audience participation. We will add sticky notes listing any vulnerable populations that you can identify that in your community that experience health disparities. You can access the board from the link in the chat box. And if you feel more comfortable, you can list your answers in the chat box and we will add them to the board. When you click on the link, you will click guest access and then enter your name. Do not forget to click I have read the privacy policy or you will not gain access to the board. You can add sticky notes by clicking the icon with 3 lines as shown on the image here. And I will now share my screen of the concept board.
And as there's a lot of people participating, guys, just remember that you don't have to entirely draw inside the lines. So if we get more sticky notes that will fit on there, we can go a little bit out of the lines. Sometimes people hate drawing outside the lines, but sometimes you have to.
And you can be creative. You can change the color of your sticky note. You can change the font. There's a lot of different things that you can do on the concept board.
Also find a few people are experimenting with some of the other tools that are on there. We're seeing a lot of people talking about socioeconomically marginalized folks, minority groups. We've got children, the LGBTQIA plus, undocumented immigrants, Native Americans. Quite a few different populations are being brought up here.
So we can get a better view of everyone's sticky notes. Okay, I see the mouse clicks have kind of slowed down. So my next thing that I would like everyone to do is if you can take the pointer icon and just add a little check mark next to the ones that you feel are affected the most in your community. And you can add a little check note just right next to the sticky note you feel that your community is affected by. And to access that, you would just click the pen or the highlighter icon on the taskbar at the top. I'm seeing a lot of check marks next to rural communities, broadband access, LGBTQ, elderly. Can't see this one. I think this one had a lot. Okay, so it seems like we're all kind of experiencing some of the same issues in our community amongst the same vulnerable populations.
I think it's important we talk about the idea that when you're talking about the disparities, that you think about the people that are experiencing them. And by looking at this, there may be some groups that you had not thought of. When we were talking earlier, when she was talking about the disparities and some access issues and some of the barriers, it's easy to think about like, okay, well, I can think about one or two groups, or I can think about the groups that come to mind the most for me. And then it's also very valuable and powerful for us to look and see that while we do have a lot of the same groups in common, are there groups on here that you hadn't thought of? Are there groups that are possibly, you hadn't thought of that experience, or how this experience with telemedicine could be powerful for them? So that's why it's really great to see a lot of people getting a chance to share their thoughts and ideas in a way that we kind of can visualize some of this. And thank you, Tanya, very much for kind of leading us through that.
You're welcome. And then now on our next board, I see some people have already gotten started, but I just wanted to also list some of the reasons for the disparities that you see amongst different populations. And then I see homeless, lack of health literacy. I see a few checks next to it, so some people can definitely relate to some of our other participants on the board. It's so great to see all of the different perspectives from what we all experience and see working in the healthcare field. So it seems like a lot of people share the experience of poverty in their community, homelessness, lack of health literacy, infrastructure, not enough providers in the area. Social determinants of health. So this board was a great demonstration to show how we all are experiencing some of the same things, different things, and how it just affects us all in our different areas and our different communities. So let's see. All right, look like the mouse clicks have kind of slowed down. So we'll get back to the presentation. I just want to say thank you so much to everyone for participating in the concept board activity. I hope this was fun and enlightening and eye-opening for everyone to see and experience. And now we will discuss specific vulnerable populations and how they are affected. And I will begin my presentation by discussing the elderly population. During my presentation, I will hit on some of the topics that were actually we spoke about on the concept board. So I'll go into a little more detail about those populations, but there are many others that I was not able to discuss, but they are important too. So some older adults are tech savvy, but unfortunately, most are not. We must take this into consideration with the swift transition to telehealth during and after the pandemic. Older adults account for a significant portion of physician office visits in the United States and often have multiple morbidities and disabilities. Many older adults have disabilities or distrust with technology that limit their capabilities to utilize telehealth. They may be left behind in the United States with the increased implementation of telemedicine. To have successful telehealth appointments, patients need to understand how the platforms work, which is likely to pose difficulty for some patients, especially older adults, as we're discussing here. Accessibility remains a top priority for older generations who may not be tech savvy or internet savvy. Some will need step-by-step guidance to log on for their telehealth appointments. Others may need family members or caregivers to help them fully participate. Older adults may also may be skeptical or hesitant to use telehealth services if they perceive them as inaccurate, insecure, and undependable. Some older adults are concerned about being able to see or hear their clinician clearly during a telehealth appointment. Some of the concerns and complaints that plague the elderly in their use of telehealth include difficult to use platforms, smaller font size, unknown acronyms, poor color contrast, small screens, English only options, and multiple screen transitions within the application. All of these concerns may result in frustration and difficulty participating in a telehealth visit. So how can we help? While some patients readily adapted to telehealth, elderly patients often struggle, requiring the healthcare environment to develop creative strategies. For patients who aren't tech savvy, the idea of virtual visits may seem overwhelming. Older patients may need to hear about the benefits of virtual healthcare visits before they happen. It is encouraged that staff members explain to older adults how virtual visits work. They should also make sure that older patients have the basics for telehealth, including internet access and devices they can use for a video call. If they do not have the resources for a video call, ask them if they have a caregiver or a family member that can help them get online for their appointment. Providers should be patient during the first few telehealth appointments. Elderly patients may need more time to figure out how to get online and logged into the video chat. If you need to check in with an older patient who does not have the resources for a video call, consider a phone call. Audio-only visits may improve access for older adults who are inexperienced with technology or have visual impairment. Elderly patients face particular health challenges when it comes to telehealth. They all are also uniquely benefit from telehealth. It increases their access to healthcare services. We must ensure that we help to incorporate some of these strategies into the telehealth framework to expand healthcare access and therefore improve health equity for the elderly population. Now we will explore health disparities in telehealth for the LGBTQ population. Lesbian, gay, bisexual, transgender, and queer citizens are a diverse community, but they share a common need for culturally competent healthcare that recognizes and responds to their specific medical risks. The vulnerable population experiences a greater burden of poor health and existing disparities in access to healthcare. Within the context of healthcare, LGBTQ+ individuals face discrimination and mistreatment, further perpetuating a community narrative of mistrust in the healthcare system at large. A great deal of prejudice still is in existence in the United States towards LGBTQ+ individuals. For these individuals, systemic barriers instills fear and subsequent neglect for individuals seeking health services. It should come as no surprise that there is a great deal of emotional and mental stress on these individuals. Within the realm of behavioral and mental health services, telehealth interventions have proven to be an effective strategy for outreach to LGBTQ+ individuals. Access to culturally competent providers proves to be a barrier to these patients. One of the most reported negative interactions with healthcare includes the need to come out to providers and the fear of rejection or negative treatment by these providers. Efforts to educate healthcare practitioners and provide them with interventional resources necessary to tackle population health disparities are pivotal in challenging the way that healthcare access is distributed in the United States. There's a significant need for education and interventional measures by healthcare providers so LGBTQ individuals can confidently show up authentically in their offices and receive equitable healthcare. Telehealth services can help to decrease feelings of mistrust and neglect and allow LGBTQ+ individuals to seek care without fear of judgment and discrimination by their healthcare providers. Telehealth can extend the reach of LGBTQ+ care, particularly for those who are less likely to seek in-person care because of concerns about privacy, disclosure, stigma, or parental notification. Culturally competent providers could reduce barriers to access in geographic areas where availability is scarce. Reports of telehealth use by this population for behavioral health concerns positions its use to be a promising practice. Through the use of telehealth, providers may be able to reach a patient population that would otherwise not have access to the care they need because they fear mistreatment or neglect. There are several ways we can make telehealth workflows more inclusive for the LGBTQ+ community. It is important to make sure healthcare is inclusive, both in person and through telehealth. Inclusivity builds comfort and trust, which helps patients get the best care possible. Assure your patient that whatever they tell you is confidential, just as it would be if they were in person. Make sure your online or email intake forms or health assessments are updated to be inclusive for sex assigned at birth, gender identity, and sexual orientation. This allows you to collect accurate information needed for telehealth care, and it also lets these patients know that their health and well-being is prioritized. Any telehealth forms should move away from cisgender heteronormative language. For example, it can say caregiver or parent instead of mother or father, or spouse instead of husband or wife. For LGBTQ plus patients, increased telehealth options do more than just increase patient satisfaction. They help to mitigate barriers to care. Telehealth targeted towards this population could prove to be an effective method for reaching more individuals and providing them with population-specific, culturally competent care. These are small but significant changes that can expand health equity to this vulnerable population. In this section, we will discuss how health disparities in telehealth affects another vulnerable population, minorities. There are significant disparities in the utilization of telehealth services for minority populations of various race and ethnicities, ages, education levels, income, and health insurance capabilities. These disparities in access to care are associated with disparities in health outcomes. Technology required to implement telehealth consultations may be problematic for some patients from racial and ethnic minorities because of cost of equipment, limited understanding of the use of the equipment, and limited digital literacy. Investments in internet access, video-enabled devices, and culturally competent care are needed to ensure equitable use of telehealth services. Although research shows that video visits offer great benefits, sometimes they require complex setup, video-enabled devices, and broadband internet access, which may present barriers for minority populations, lower income households, and those with limited English proficiency. Racial and ethnic minorities disproportionately lack access to broadband infrastructure and the digital literacy to successfully utilize technology to improve their health outcomes. Patients and providers need access to devices that are affordable, easy to use, and consumer friendly to ensure that the delivery of telehealth services are equitable. Given the significant cost for smartphones and data plans, patients in lower socioeconomic status neighborhoods are more likely to choose audio-only visits over video visits. According to the census data, 80% of white adults report having broadband connection at home, while Black and Hispanic adults report lower numbers, 71 and 65% respectively. This brings some perspective to the equity gaps minority populations are experiencing. Telehealth disparities due to the digital divide are prevalent among individuals who have limited English proficiency. 60.4% of the internet content is in English, compared to 4% in Spanish, the second most common native language in the United States. English proficiency has an effect on the access to healthcare and utilization of telehealth. There are substantially lower rates of telehealth use among people with a language barrier compared to proficient speakers of English. Telehealth for minorities offer promising outcomes, particularly when delivered in the patient's preferred language. Issues related to health equity experienced by minority communities often lead to mistrust in the healthcare system. Therefore, telehealth is underutilized by these populations. Without purposeful action to help alleviate digital barriers associated with age, race, location, preferred language, and socioeconomic status, permanent expansion of telehealth could have the unintended consequence of widening health equity gaps for the most underserved communities. Telehealth is an innovative healthcare delivery model with the opportunity to expand access, but we must implement efficient strategies. Unfortunately, telehealth has the potential to create, reinforce, or even widen health disparities. The development and implementation of guidelines, policies, and practices in relation to telehealth for minorities should consider all of the barriers that could exist. Many individuals do not have access to technology, such as smartphones and adequate broadband internet access. Without the necessary technology, accessing telehealth services is challenging, if not impossible, for some. It is important to include more resources as part of your practice to reach these patients. Sometimes patients are not informed about the options for free cell phones, help with broadband access, and internet discounts that are available in this country and in their area. To address the need for multi-language resources, organizations must provide meaningful access for these limited English proficient patients through language services such as oral interpretation and written translation. In addition to providing language services, all providers should also keep in mind the cultural needs that may affect care. Determine what languages are most relevant for your practice. Create multilingual patient resources and offer interpreter services. Review patient communications to decide what should be translated into other languages. If possible, match the patient with a provider that is proficient in their language. The access to a more diverse pool of telehealth providers would enhance utilization of telehealth services, which could improve health overall in these communities. Telehealth has a great potential to bridge the gap in access to care by connecting isolated people with culturally competent health practitioners and reducing the need for transportation to receive such care. To adequately address health equity in telehealth, we must acknowledge the importance of culture, incorporate the assessment of cross-cultural relations, recognize the impact of cultural differences, and expand cultural knowledge. We then adapt the services we provide to meet the culturally unique needs of our patient populations. We will now move on to discuss health disparities in rural communities. Rural patients also face more health challenges, including higher levels of disability, more chronic conditions, and more health-related needs. Rural communities may be at increased risk due to less access to healthcare and health insurance coverage compared to their urban counterparts. Telehealth maintains and expands care for underlying medical conditions for underserved populations. Broadband access is a significant problem in rural communities. In the graph shown here, you can see the difference in broadband access in urban areas compared to rural and tribal areas. The United States and urban communities are close to 100% broadband access, but rural and tribal communities are only at 82 and 79%. There is a significant gap in access to broadband access, as you can see here. Some internet service providers refuse to invest in rural broadband infrastructure given a small customer base. As a consequence, more than 40% of Medicare beneficiaries lack access to a computer with the necessary broadband connection to support a video visit. The overall distribution of physicians in the United States is exceedingly uneven. Physicians are highly concentrated in urban areas, and rural places have very few, and in some, none. Physicians often are located close to hospitals where they have privileges, and much of the population of a large rural area could be many miles away from a physician. Furthermore, physicians more often move from rural areas to metropolitan areas than the reverse. Rural populations consistently suffer from a shortage of physicians in person and via telehealth. Providers in rural areas are less likely to have telehealth systems capable of facilitating patient engagement, such as scheduling appointments online, requesting prescription refills, submitting patient data, viewing clinical notes, and accessing medical information. Approximately 80% of rural areas in the United States are classified as medically underserved and in health professional shortage areas. These regions are lacking the physicians, dentists, registered nurses, and behavioral health providers and other health professionals needed to care for a patient throughout their lifespan. To bring health equity to rural areas, we must examine how telehealth can improve care coordination, healthcare quality, and health outcomes among these residents. This will also be helpful to bring policy interventions that incentivize, encourage, and expand the use of telehealth among healthcare providers and patients, especially in our rural areas. So how can we help these communities? Telehealth can bridge the gap for rural patients to get the care they need, but the idea of virtual healthcare may seem intimidating, confusing, or expensive to people who are not familiar with the technology. It can help reduce barriers to care for people who live far away from healthcare services and specialists who have time and access restrictions and who also have transportation or mobility issues. There are many unique challenges for rural telehealth, from rural patient needs to technical troubleshooting to geographic remoteness. However, reliable internet access is a prerequisite to telehealth services in rural areas where broadband internet is scarce. The broadband gap has the potential to lead to a new set of health inequities due to disparate access to telehealth. In recent times, there has been some federal initiatives to address broadband access. We must ensure that patients are aware of these resources that are available to help them access high-speed internet in their area. We have to continue to advocate for policy change on a federal level. A challenge for rural telehealth providers is Medicare or Medicaid reimbursement. These concerns related to geographic and originating site restrictions, provider restrictions, and service restrictions. Some health insurance companies reimburse for telehealth services while others do not. Some of these issues have been temporarily solved by the public health emergency telehealth flexibilities. We should also work to ensure organizational readiness for the swift transition to telehealth. By expanding access to telehealth services in rural areas and ensuring a competent workforce in rural areas, we can address health equity issues. Also, it's important to allocate more resources to educate medical staff on using health technology platforms so they can provide patients in underserved areas with telehealth tools and access to internet. Providers should encourage their staff to learn how to broaden telehealth access so they can inform the patient population about federal support for broadband access. Sometimes this can be at a discounted rate or sometimes no cost. In rural practices, they can incorporate efforts such as calling patients ahead of a telehealth visit to confirm if they are able to attend and finding out if they are comfortable with and have the access to necessary technology needed for a telehealth visit. Using telehealth in rural areas to deliver and assist with the delivery of healthcare services can reduce or minimize challenges and burdens patients encounter, such as transportation issues related to traveling for specialty care. Telehealth can also improve monitoring, timeliness, and communications within the healthcare system. Telehealth is especially crucial to providing health equity in rural areas that deal with major health disparities. Finally, we will discuss how mental health patients are affected by health disparities in telehealth. The steady rise in mental health conditions such as depression, anxiety, trauma, and substance use related to the pandemic has been recorded in national surveys. Telemedicine is seemingly the ideal solution to this problem. However, vulnerable populations often lack the necessary internet bandwidth or even the access to the technology to make this solution a reality. Research has shown that those residing in rural areas have less access to mental health services and lower quality therapy options than those residing in larger cities. They are less open to seeking and utilizing mental health services because in a small town, an individual's personal business may be more open to public scrutiny due to decreased anonymity. Also, in certain cultures, mental wellness and treatment are unusual and looked at negatively. African Americans and Hispanic Americans have much higher rates of untreated adult mental illness, serious mental illness, and major depression. Furthermore, they have limited access to prevention, treatment, and recovery services for substance use disorders. People of color and underprivileged individuals are not only more likely to have mental health issues due to the pandemic, but also encounter more barriers to accessing and using mental health services. There is also financial barriers that some patients encounter. A single therapy session can easily top over $100 without insurance in many parts of the country. And telehealth has done little to change that. High price means that both therapy and teletherapy remain unattainable for many populations. There are simply not enough therapists to go around, and many people who live in the US live in an area with a shortage of mental health practitioners. To meet the demand, we not only need more therapists, but we also need more therapists from a diverse background. In order to reduce the gap in mental health access, we need to create a trustworthy system where people feel they can connect with their therapist or psychiatrist. Mental health care can help address this gap, but significant efforts are needed to implement the change. So how can we help mental health patients? Mental health care can provide effective and adaptable solutions to the care of mental illness universally. Telehealth has helped increase access to medical care and mental health services at a time when the pandemic limited patients' abilities to see a doctor or healthcare professional in person. As we look beyond the pandemic, there's an opportunity to continue to leverage telehealth and telemental health services in a way that breaks down barriers to care and advances health equity. We must prioritize change in regulatory and reimbursement policies that encourage vulnerable populations to seek telemental care. All mental health and behavioral health systems should consider completely integrating telemental health services to reduce inequities in mental health care access, utilization, and long-term outcomes for these patients. We believe that a multi-pronged approach is necessary to mobilize resources at a national, state, and community level. Establishing an effective and sustainable telemental health system will help to mitigate the telemental health divide during and after the global pandemic. Underlying issues of telemental health disparities need to be addressed by engaging the community and community-based organizations to help combat issues of device access, equipment, internet connectivity, and basic training that is needed for patients to feel comfortable utilizing telemental health care. Working with the communities and community-based organizations will hopefully help to identify optimal and sustainable solutions to a structural problem in our healthcare systems. These organizations can also help to disseminate information to vulnerable populations, notifying them about mental health services that are available and how to access these services. Culturally sensitive and linguistically adapted telemental health services should be offered to vulnerable populations. Understanding cultural stigma and social norms surrounding mental illness for people of color is crucial. We also need to focus on diversifying the professional workforce by providing patient-centered telemental health services. Patients often feel comfortable with providers that look like them and understand their culture. We must create initiatives to diversify the professional workforce, which is critical in providing patient-centered telemental health services. Patient privacy and data security should be well protected in the telemental health care environment. Ethical and regulatory concerns exist about the use of technology, since the patient's privacy might be at risk, and the physicians need to ask who else may be hearing the conversation between the clinician and the patient, and encourage a more private, secure location for the patient to conduct their visit. Continue to enforce patient privacy and data security so that patients feel comfortable and safe about disclosing their confidential information. So after discussing different types of vulnerable populations and how they are affected, we must ask ourselves, how can we address the burden and maximize the benefit of telehealth for these vulnerable populations and many more? Addressing the benefit and burden of telehealth services starts with creating a health equity framework. We must identify, understand, and address health disparities. Identify means increasing awareness of disparities in healthcare that exist, recognizing and measuring disparities. Understand means investigating patterns of health disparities that impact various patient outcomes. Address means developing interventions to improve health and well-being of vulnerable populations, forming an action plan to address these disparities. Health equity is a key driver for mental and physical well-being of patient populations in our communities. To achieve equity in our healthcare system, we need to understand where and why barriers to health exist. Then we must make a concerted effort to drive change to the healthcare system, which puts equity at the center. Make health equity a leader-driven priority. Healthcare leaders must engage, act on, and build the organizational vision. We can collectively help to improve health equity by working to develop structures and processes that support health equity, taking actions that address social determinants of health, identifying health disparities and the needs of vulnerable populations, and by confronting institutional racism within our health systems. We must dismantle the structures, policies, and norms that perpetuate health disparities in our communities. Addressing health disparities in the United States is not a short-term effort. An organized and thoughtful approach will take a long time to drive the important change in the current moment and to impact future generations. Working to make health equity a strategic priority is one of the most important elements of this framework. Equity must be viewed as a critical mission. The mission, vision, and system of healthcare cannot thrive without a focus on equity. Organizational leaders must commit to improving health equity by including equity in the organization's strategic goals. Healthcare organizations must look at their system, practices, and policies to access where inequities are produced and where equity can be proactively created. We must encourage health systems, providers, and community organizations to address health literacy and accessibility barriers as they provide virtual health services. Another idea is involving healthcare coordinators in the telehealth workflow to be a great asset to vulnerable populations who don't understand how to navigate the telehealth system. This solution can take some of the burden off of the clinician to provide patients with resources that can address health literacy and accessibility. Healthcare organizations must develop strategies to address the multiple determinants of health. This includes analyzing healthcare services, organizational policies, the physical environment, and the community's socioeconomic status, and encouraging healthy behaviors. Within the healthcare system, we must work to eliminate racism and other forms of oppression for historically marginalized communities. To support communities to reach their full potential, healthcare organizations must work in partnership with community members and community-based organizations that are highly engaged with community members. The partnership with the community organizations can help to advance the health equity framework. Other important parts of the framework should include a focus on broadband access for all populations. We should prioritize intentional technology design geared towards those who have difficulty with technology access that is simple and easy to utilize. Deploying programs designed for measuring and strengthening digital literacy is another important aspect. Health systems should aim to widen access to telehealth by devoting resources toward improving workforce diversity. Overall, we need more resources, time, telehealth access, and research data to adequately address health disparities. The future of telehealth relies on a successful framework that offers an important tool towards determining the best clinical and policy changes to ensure and not restrict access to quality and equitable healthcare for all. Innovation and involvement of community organizations can help to reduce inequities that will lead to improvements throughout the system. At my organization, Well Ahead Louisiana, we have several initiatives to improve health equity. Through the DSMES via Telehealth project, Well Ahead Louisiana is partnering with healthcare systems throughout the state to expand the use of telehealth technology to deliver DSMES programs in underserved areas. Well Ahead offers detailed information that helps facilities to implement these services and get accredited. Telehealth technology is one solution to improving access to this program in underserved areas. Telehealth services follow the same curriculum as in-person DSMES, and participants are required to complete session items such as participant assessments, just as they would during our in-person program. Participants also have access to the same resources and tools that they would have during an in-person program. We also offer a virtual option of the National Diabetes Prevention Program. This is a research-based and in-person online program focused to support healthy eating and physical activity, and it helps participants maintain a healthier lifestyle over time. Implementing a national DPP can provide people with prediabetes the tools and the resources needed to prevent their conditions and lower the risk of other chronic diseases. This national effort creates partnerships between healthcare providers and community-based organizations to offer evidence-based, cost-effective interventions that have been proven to help prevent type 2 diabetes in communities. We also have a new program, the Health and Lifestyle Training, HALT program. It will be utilized to deliver the CDC's National Diabetes Prevention Program. This platform enables virtual delivery of the year-long lifestyle change via a mobile app. Participants will be assigned a lifestyle coach to support them through their journey, and they will be guided through interactive and online video lessons and will be able to access a food journal and activity log. So to address the gap in healthcare providers in rural areas, we have a Rural Health Scholars Program. And we offer mid-level health profession students the opportunity to complete a short-term rotation in a critical access hospital, rural health clinic, or a federally qualified health center. Each grant year, the program builds partnerships between state colleges and universities and the rural and underserved healthcare facilities to identify up to 20 students to be rural health scholars. There are currently 18 students serving a clinical rotation across the state of Louisiana. Here at Wellhead, we also have a Project Echo, and we are hosting 2 programs currently, a Diabetes Echo and a Lifestyle Coach Echo. Project Echo is a movement to demonopolize knowledge and amplify the capacity to provide best practice care for underserved people all over the world. This model connects providers and specialists on a live virtual platform to share knowledge and expand treatment capacity in rural communities. The ECHO model does not provide care directly to patients. Instead, it provides frontline clinicians with the knowledge and support they need to manage the patients with complex conditions in their own communities. The ECHO model develops knowledge and capacity amongst community-based providers through the use of technology to leverage the scarce resources, share best practices, and reduce disparities. This is a case-based learning to master complexity and monitoring of outcomes using a web-based database. Wellhead is fueling innovation in rural health. Through several different grant programs, we offer providers support to expand their telehealth capacity in our rural communities. We are also in the beginning stages of assessing the need for rural health providers to improve their telehealth capabilities. On our website, we offer toolkits and trainings that providers can access to learn how to implement a telehealth program to offer the care where it's needed most. We also have a new health equity division focused on eliminating health disparities and increasing health equity. Through grant funding and program implementation, we are concentrating our efforts in certain regions of Louisiana that are in need. There are various initiatives in this division with and without a telehealth focus that address health and social inequities. So in summary, there is no question that virtual healthcare can provide access to essential healthcare and improve health outcomes for vulnerable populations. As telehealth becomes the new normal, it is imperative that we review and have a deeper level of understanding of the key promises and perils of telehealth. Reducing disparities is an effort that we must address from the bottom up. The goal is to alleviate the burden of disease in disadvantaged populations. Telehealth also offers wide-ranging opportunities for flexibility and innovative improvements in healthcare. The pandemic exposed disparities in access to internet connectivity across the United States, known as the digital divide. This digital divide is due in part to a lack of broadband access for many people. A concerted effort will be required to ensure that the disadvantaged and marginalized groups have the necessary technology and digital literacy to take advantage of telehealth. Sufficient infrastructure must also be in place, and health professionals and patients should be educated on telehealth utilization. Our hope is that we can uncover more ways to make telehealth work for everyone. Telehealth services must meet people where they are. To accomplish this, we must consider the following and much more. Maintain appropriate reimbursement and coverage policies for audio-only services after the pandemic. Create a plan to address digital literacy and broadband access. Identify and address social determinants of health. Tailor health communications to address specific barriers or areas of concern, such as privacy or usability of the technology. It is important that we are mindful of not reinforcing health disparities when building out access to telehealth. To ensure that the benefits of telehealth outweigh the burden, policymakers will need to consider creative, innovative, and financial solutions. We need to be vigilant to not only prevent the increase of existing healthcare disparities, but to recognize and reduce them wherever they may exist. Together, we must work to identify, understand, and address the unintended health equity impacts due to the swift pivot to digital health. Thank you so much for your attention. I'll be happy to answer any questions you may have.
And I really appreciate you, Tanya, for that great presentation. You guys can post your questions here. You can also, yeah, Dr. Santos, post it in the chat. If you want to raise your hand, there's a reaction option where you can raise your hand. I actually can allow you to talk. So if you have a question you want to do it not in the chat, you can also do it by raising your hand. It'll allow me to let you talk. That was a great presentation about a lot of different groups. And like we saw from the interactive element, there's, it's really impossible to cover all of the groups that really have, disparate needs, and they're not always, there are reasons for why they may have different needs or different, the barriers are different. And I think a lot of it, we saw some good questions in the Q&A during your presentation about where do we access some resources and where do we do things? And so your website at Well Ahead has a lot of great resources. The TEXLA TRC has a lot of great resources, and the National Consortium of TRC also is a really great way to get a lot of those same resources there.
And I would also be interested to know if anyone that's listening to this presentation has any other programs that they have in their communities that they're working on that address health disparities, health equity, if anyone would be willing to share.
I also would love that. I mean, it'd be great to hear from some of the people who are out there and working on these types of programs, and they're, kind of on the front lines of changing things to provide better outcomes.
Hey, Derek, I would like to thank Tanya Williams for the comprehensive discussion on equity and access in telemedicine. And I agree with your presentation. Telemedicine is a tool that will decrease the gap of the disparity, but even though with the telemedicine, the gap still exists. And, this could be due to lack of resources, logistics, infrastructures, providers. You tackle all of them: digital literacy, digital divide. I love, by the way, the audience participation. That's fun, by the way. Thank you for doing that for us. I'd just like to add that the federal government and the state government, as well as multiple organizations like AARP, the ADA, AMA, AAMC, ATA, the HSS, or the Health and Human Services, as well as the national consortium where, by the way, TEXLA TRC belongs to, are doing a lot of projects to educate the population, as well as the providers, to address this issue, to bridge this gap. And I am a firm believer, there's a study at the University of Birmingham that free internet access should be a basic human right. I think it should be as essential as water, electricity, housing, because all of our activities nowadays are technology based, and I think we should have free internet access. We had a discussion with Derek earlier on a while ago that we have to sometimes be creative. The medical institution, academic medical institution like Texas Tech, our local libraries, restaurants like Taco Bell, and even Cotton Gin here in West Texas, provide broadband access. So sometimes we have to tap those resources and probably be creative. I would like to just reiterate, that telemedicine could be a means, to bridge this gap, especially nowadays. With increasing prices of gas, I think telemedicine is a greener option as well. I'm not saying that this is the panacea for all our ills, in our healthcare, but I think this is one of the tools to bridge those gaps.
I think you have to be careful about the internet as a basic right, because I have teenagers, and if I can't take it away from them, it'd be awful at the house. So, I agree though, it's very powerful, and it's a great tool, and the telemedicine as a tool is a great tool, and it changed a lot of things. And I think we're talking about the internet, we go back to think about when I was younger. I'm of that generation that remembers when there wasn't internet, and then I was on the internet in the very beginning, when you had to dial up and all of that good stuff, and then now we're in broadband. And thinking about how those tools change the world and change business and everything else. It's interesting to think that we're on that precipice right now. That's why it's a very apt name, is Crossroads conference, is because we're at that crossroads where very soon, telemedicine may be that tool that really, really changes healthcare forever. And I don't think there's a way we're going back. We're not going to put the genie back in the bottle. I think we got a big jump start because of COVID and the pandemic. I think that sort of jump started some of this, but I feel like this is a train that's going to build momentum, and it's going to do a lot of good things for a lot of different people. And of course, yeah, we will have the recordings of this posted. All of the recordings and information will be posted to our TexlaTRC.org website. After all of the conference is over, we go through and we take them, kind of clean them up a little bit and put them on our website afterwards.
And I do have a couple questions too that came into me directly. So just wanted to direct those to Tanya and then the group as a whole, as well as anybody that wants to chime in. So one that was in the chat, but we could potentially discuss it a little bit further, was the last question submitted in the Q&A. How do you identify health disparities in patient population in outpatient setting, especially when you do telehealth services and do not have face-to-face contact? Is there a tool to identify patients who need equitable care? I think that would be a good one to dive a little further into, if you don't mind.
And I did try to answer that to some degree in there, that, of course, all patients need equitable care. And I think a lot of it comes down to how you build your telemedicine program. If you build it intentionally to make sure that you're providing that, it's a lot easier to provide that equity when you're thinking about it in the beginning than trying to go back and change everything later. So that's kind of the one thing. But yeah, it is difficult to, I think that the root of that question relates to, how do you know what their needs are if you're not, can you determine their needs as well through telemedicine than as in person? And in some cases, you can even better. We're definitely hearing about some doctors that were able to work with patients that are doing telemedicine, and they were doing diabetes counseling, and they were able to say, show me what's in your counter. What are you eating? What are your snacks? What's in your fridge? And that's a powerful tool, because they wouldn't have normally had that if you were in person. So there are some ways where the telemedicine actually serves a lot better. It actually provides more options for you, but definitely on the issue of equity, that's a good question to ask.
Yeah, I was going to chime in with what Derek was saying, and I'm pretty much going to say sometimes it just takes to ask the questions to understand what that particular patient need is, because it's like, I can say I went into minorities, but it's like we could really break down just that topic of minorities into so many different categories. And then on an individual basis, every patient needs a particular need. So I definitely would say asking the questions would help you to identify the need and those health equity gaps. That would help.
Yeah. I know in a recent presentation I was part of too, or that I was a viewer at, they were talking about a lot of patients won't necessarily volunteer information about what they're maybe struggling with or what they could use help with. So like you touched on, asking the questions, if our provider force, nurses, schedulers, physicians, everybody gets accustomed to asking those questions, what kind of resources do you need? Is there any way we could help make this easier for you? I think that's very important. Thank you.
I see a great question from Rebecca in the chat. She's asking about Medicaid, Medicare, other insurers, and remote patient monitoring tools such as wearables. And we know there's a lot of movement in that area. There's a lot of people working with that group. There's a lot of people that are doing work in that telemedicine area, where that is a very powerful thing, because it really saves them a lot of time from having to travel, especially in a rural environment, and they need to go and work with their doctor and getting that data on a regular basis. We've seen some presentations on that recently, and I think part of it was that they were saying, you can issue the equipment, you can give them training on it, but you can't always make them wear it. You can't always make them take their pill, their blood pressure medicine or whatnot. But there's some ways that telemedicine helps with that, because you can check in more often, and you can see remote patient monitoring allows you to check and say, hey, well, this patient's, they are, or they not doing the things that have been prescribed for them. So That is one way we're seeing a lot of that in rural areas, that remote patient monitoring is very powerful.
And I know sometimes in our echo sessions, we discuss how something as simple as everyone has a smartphone, setting a reminder. When they're in your office, taking their phone and be like, okay, let me go in and add a reminder to your phone, take your meds at this time. It's like sometimes, I know I'm a list person, so sometimes I need that little nudge. So that can be helpful, especially for your elderly patients, if they do have the access to something like a smartphone.
Tanya, I'd just like to add as well that probably having a checklist before the telemedicine encounter usually helps, making sure we ask them what do they need. And I'm one of the person who is advocate of this, of having a patient navigator. But sometimes, especially in some population, especially in elderly population, they need a little bit of a guidance and making sure, we could change the font in your cell phone. We could do this for you to make the experience much more better, especially the telemedicine experience. And I would like to mention that Sarah had a great comment there as well, regarding working with older population. We must remember that processing information like instruction how to use mobile options in telehealth and whatnot. And there's a lot of student-led organization that are now working on helping and educate. Our medical students are great conduit to probably help educate our population as well. So we have a comment there from J. Kim.
Looks like another question came in through the Q&A box too, that Derek's typing an answer to, but are there social services provided through telehealth?
Social services as in like a patient navigator, like kind of like Dr. Santos spoke about.
I posted a link to the Medicaid and CHIP teleservices. So there's some CHIP services, which would be considered social services.
Okay.
And that in Medicaid services that they do, and they have a timeline where a lot of it's coming in winter of 2022. So it's coming, it's going through the process. They have some background legislation on there and some resources that talk about it. And so you're seeing that in legislation right now. That's a big part of this issue, is that a lot of things are still operating under the public health emergency. We're still under that PHE. And, originally was set to expire, and then it got extended, and it's getting extended again. And when that is not being extended, it's going to create change, because there's certain things that we are allowed to do right now through that PHE that aren't codified yet. And so, it's legislators are going to have to think about getting something on the books, basically, for which parts of it they want to keep around, or they're going to have to keep extending that PHE to let those services continue. So we are running into sort of a cliff in telemedicine services where if we don't get anything done through legislative means and methods, then when that PHE does finally expire, which it will eventually expire at some point, it may provide some where we have to go back to the way we used to do things, and that may widen the disparities, because there's a lot of people that are relying on those services now, and those may be kind of taken away. So I'm seeing a lot of movement, a lot of, in both federal and state level. We're seeing a lot of people, a lot of bills being put out there, a lot of people putting things out there. And there's also, the CC, Cynthia put a great resource out there, which we use, which is our, has a lot of stuff about the laws and regulation for telehealth. And so that's something that is going to have to happen. And we're hoping that it happens, because that will be a great leader of the change. It's going to be a great way for us to keep moving forward and providing good telemedicine, telehealth services to people.
Yeah, you put in a great way to sum it up, Derek, when you said you can't put the genie back in the bottle. So that was a great way to put it, because it's like now we're seeing that they realize, okay, maybe this service can be provided in that one. And, hopefully, our legislators get on board with allowing more access to some of these services that we've been enjoying during the PHE, but definitely the genie can't go back in the bottle. I think that's it for questions and chat. And I'll just go ahead and put my contact info up here. If anyone would like to reach out, you can email me. And thank you everyone for the questions and the conversation and your participation during my interactive element.